And we promised you one more interview, so here it is. The South African Population Research Infrastructure Network, or SAPRIN, says that it will continue to monitor the demographic, social, health and socio-economic well-being of the entire study population. Now, SAPRIN is a national research platform funded by the Department of Science and Innovation and is hosted by the South African Medical Research Council. Now, they recently responded to the COVID-19 emergency by developing a surveillance protocol that was implemented within a month of the first case being reported in our country. So to improve its response to COVID-19 and other epidemics, SAPRIN will add new health and demographic surveillance information to improve on the research and population demographic info that they already have. So to tell us more about this, I'm joined now by SAPRIN's Director, Dr. Kobus Herbst. Thanks so much for your time this morning.
Thanks, Akina, and good morning to your viewers as well.
Dr. Herbst, all sounds very technical. Perhaps if you could just break it down for us so that all of us can clearly understand what exactly the COVID-19 population research is about.
Yes, maybe I should start by explaining what demographic and health surveillance actually is. In essence, this is a partnership between a specific community. And historically, there's been 3 such communities in South Africa, which have been working with researchers now for more than 20 years. The original one is in Bushbuckridge in Mpumalanga, called Wits Agincourt Center. And that was followed a few years later by another center in Limpopo province called Dimamu and operated by the University of Limpopo. And then in 2000, a site in northern KwaZulu-Natal operated by the Africa Health Research Institute. Now, each of these 3 sites work with communities of approximately 100,000 individuals, about 20,000 households. And we visit these households several times a year, 3 times on average. And lately, we have changed that with the advent of new technology to, rather than physically visiting the households, to call them via telephone, call centers that we've established at these sites, and then only visit them once a year, where we take samples, blood samples, for example, for various tests. So SAPRIN then, as a research infrastructure, fulfill 3 main functions. One is to provide a very up-to-date, detailed information of population dynamics. Secondly, to be a research infrastructure, so the different universities, research institutes that are involved in these sites do additional research funded by a variety of research funders within these populations. And then finally, the data from these studies are also used by postgraduate students for research and for training purposes. We work quite close. Yes.
I just wanted to ask Dr. Herbst, you say you've done telephonic interviews and this in more than 60,000 households in the provinces that you mentioned, Mpumalanga, Limpopo and KwaZulu-Natal. So how accurate is that information that you actually gather?
Well, firstly, it is assisted by the fact that we have these close relationships with the communities, so they understand why we are doing the research, and we have very high response rates and consent rates of more than 80% contact rate, more than 97% consent rate. So we know that we are reaching virtually everyone in those populations. So that contributes to the accuracy. And the fact is that because we contact them relatively frequently, we don't have the problem where people have to recall for a long time what has happened in the past. So we're quite confident that the information is quite accurate. And we've contributed this information to a work that the Statistics South Africa has done, and also the recent survey by the Health Systems Research Council on the response of or the impact on households of the lockdown measures. And so we work quite closely with other role players in this area to augment the information that they also collect.
And speaking of impacts, Dr. Herbst, your research so far, as you outlined, focuses on rural communities. So what is that information telling you at the moment? Does it give us some sort of indication, a picture about the impact that COVID-19 has had, at least on these communities that you have focused on?
Absolutely, it does. And because we have these fine-tuned data where we contact the people constantly, we can actually even see over the different weeks of these control measures what has happened. So, for example, we have one measure of the anxiety of people. It's a standardized measure on anxiety, a so-called anxiety score. And so we could see that in the very first week of the lockdown, almost a third of people have shown signs of anxiety, and that has declined over the weeks to where we now at around just over 10% of respondents are showing objective signs of anxiety. Also, we've seen that in the first week, almost half of households reported difficulty in accessing services like health services. I think and that again has declined over time to now about a quarter of households saying that. So as people have adjusted to the measures, as services have adjusted to the measures, we see that the impact of these measures are declining.
Well, we are unfortunately out of time, but appreciate you sharing at least some of that with us. But if I could just maybe squeeze in one final question, Dr. Herbst, with regard to population clusters, which are currently most affected by COVID-19?
I mean, that is why we have added the 2 new nodes in metropolitan areas, because up to now we were only able to say something about rural populations, with a node in Gauteng that will work with communities in Atteridgeville, Malusi and Hillbrow, and the node in Cape Town that will work with communities in Bishop Lavis and Umzamu. We will be able to broaden the set of populations that we can say something about.
Well, thank you so much for your time this morning, SAPRIN Director, Dr. Kobus Herbst, and very interesting information there. The South African Population Research Infrastructure Network, or SAPRIN, saying they will continue to monitor the demographic, social, health and socio-economic well-being of the entire study population in regards to their response to COVID-19, and of course indicating that they will now also extend that research to areas in Gauteng and the Western Cape.